Good to be here with everyone. I want you to open your minds and use your imagination. I've been in this profession for about 37 years, and I want to maybe talk to you about the future of the profession. What if dentistry was really about getting rid of inflammation? What would that be like first day of dental school? Well, we'd be prepping ourselves to do everything we could as a profession to lower inflammation. We'd be working with cardiologists and internists like Brad Bale, like Bale and Deneen. We'd be doing salivary testing to rid out P. gingivalis, the high-risk pathogens, and our whole focus would be different. What if dentistry was about reversing Alzheimer's and dementia? And we've heard some great speakers. I believe that dentistry is about lowering inflammation, and I think our major role in dentistry is trying to reverse things like Alzheimer's and dementia. We'd be doing home sleep testing on people in their 30s and their 40s because dementia doesn't start at 65, dementia doesn't start at 70. Dementia, what's your name? You look familiar. Bruce, I knew you once. If you think about it, where'd I put my keys? Where'd I park my car? Why did I come into this room? That starts in your 30s and your 40s. Dentistry is a main player in preventing Alzheimer's and dementia. What if we as a profession could help rid anxiety, depression, and panic attacks? I'm here to tell you today that I think we can because I do it every day in my practice. Imagine a man is coming into your room and he's going to choke you. He's going to put his hands around your neck and strangle you, choke you. He's going to do it 10, 20, 30, 50, 100 times a night. And if he doesn't choke you, he's going to come in. He's not going to tell you when he's going to break into your room, and he's going to hold his hand over your nose, and he's going to pinch your nose. I would have anxiety. That's what happens every night when you have breathing issues, when you have sleep apnea. So we play a huge role in anxiety. What if in hygiene school, Jen, they told you that you could get 50% of all children off of ADD medications? We know now we can. We've got to start early because the brain is largely developed by age 5 or 6. We can't start orthodontics at 11 or 12. So we are advocating you start at age 2.5, age 3, 3.5. I want all kids to be mainstreamed, if possible, by kindergarten. That means we really have to start early. How do you do all this? How do you get into you're already in a profession. How do you get to being able to transform lives? Dr. Gupta, how do you do it? Well, we've invented a method called the TAO method. The TAO, the Tao, the path, the journey. And that journey starts very simply, and what is TAO? TMJ, Airway, and Orthodontics. The path can start on Monday with your Nightguard. Did you know that 50%, and I think the number is really like 90% of the night guards that are worn every night in this country are actually closing the airway? Didn't we sign an oath to do no harm? It's a Harvey Weinstein moment in dentistry. We've drawn a line in the sand. You're not allowed anymore to close an airway. So if I'm making a flat plane appliance like I learned in dental school, like I had to do to pass my boards, I'm telling you that if you're just using a flat plane appliance, cuspid guidance, beautifully made, great contacts, there's at least a 50% chance that it's closing someone's airway every night. Those are the night guards that we're putting in as a profession. It's very easy to become an airway-centric dentist and modify that bite plate just a little bit, bring it a little bit more forward, and now you've begun your pathway. Now you've begun your journey, and it's very easy to do that. I came up with the promises. Like in a 12-step program, there are promises, happy, joyous, and free. Well, I came up with the airway promises. If you'll go back on Monday, and this could be an assistant who's here, a hygienist, If you'll just make a different type of night guard, your patients can wake up refreshed, no snoring, no clicking or popping. You can get rid of their airway and in a better mood. That's a pretty nice set of promises to make. That's the way to get into it initially. How do you recognize these people? Lane and I and Jen, and I'm very lucky to be working with them, we can see the patient from across the room. Retruded jaws. And you know, our faces have changed. Did you know that over the last 200 years, really over the last 10,000 years, but more so over the last 200 years, our faces have gotten narrower. There's not room for all 32 teeth. Our teeth are more crooked every generation if you look at the work of Weston Price. It's related to epigenetic factors. It's related to pollution. It's related to plastics. It's related to everything, preservatives in our food, glyphosates, pesticides. So that, what would you do if I told you that the jaws are getting smaller with every generation? We look in the mouth, we see high vaulted palates, we see big tonsils, large adenoids. This is the beginning of the path. So, what do we do? What do we do about it? What else can we do about it? Well, men are in denial and women speak in code. Men are in denial. Do you snore? I don't snore. It's my wife who snores. I don't have a problem. She has a problem. You ask a woman, women speak in code. Do you snore? Are you tired? No. Could you be more refreshed? Oh yeah, I could be more refreshed. So it's how you say it. We want to start treating the person. We don't want to treat the teeth in the person. We want to treat the person who has the teeth. Okay, we want to start treating the person. So this is a shift that we all can make. What I'd like you to do is go back, like Lane suggested, and ask yourself, what if? What if? Am I ready to make this shift? Am I ready to transform people's lives? Is it something that I think I'm ready to do? And if you are ready, join us on the journey, join us on the path. Thank you very much.